Good evening, am I audible?
Yes, ma'am.
Okay. So I think everyone have joined, right? Just wait for 2 to 3 minutes, then we will start the class. Eight minutes, 8 minutes. Shall I start the class?
Yes, ma'am.
Okay, because 3 to 4 students couldn't be able to join the class today. They are attending the Ittimam's workshop. So we shall start today's session. Today's session is obesity in women. So first of all, we have to know that what is obesity. So it is a medical condition which can be characterized by excessive accumulation of body fat to that extent which imparts the negatively effect on individual's health or a person's health. So in short, if we say it is completely a condition after the overweight of the person or a individual has gained that much weight, that much high, he or she might be highly overweight. So that condition is known as obesity. How we can assess a person is obese or not? So we measure the BMI. You all are aware of that. That is body mass index. How can we calculate the BMI of any individual? The formula for the BMI is very simple. That is weight in kilograms divided by the height of that person. That is in meters square, right? So if a person is having a BMI of 30 or higher than 30s, it is typically classified as the obese class. Below 30, it is grade, like we call it overweight or grade 1 or borderline obesity. But 30 and more than 30 is considered as obese or obesity, or we can say the person is having a person who is having 30th BMI or more than 30th BMI is obese or is suffering from obesity. How obesity is influenced or how obesity is more prone to lethal or hazardous. So obesity is influenced by so many factors. It may be genetic, it may be behavior, it may be lifestyle, metabolism, and the environment in which that person is living. So it is not a simply, we could not gain so much weight by overeating only or lack of willpower. sometimes while consuming more calories than the body needs. That is, if we are taking over nutrition, that is more than our own need, more than our respective need. So it will ultimately lead to weight gain, right? So there are so many causes, so many different causes of obesity or the overweight or the obesity, which we will study in this chapter. So there are so many health implications of obesity that can affect multiple organ system as well as like excessive body fat. It directly lead to the risk of so many medical conditions including diabetes, mellitus, cardiovascular health, heart diseases, strokes, and uh, tumors, cancers, and so many bone disorders and reproductive health also. It also affect the reproductive health of the body. Obesity can also impart its negative effect or its negative impact on mental health of that individual. By how? uh, in peer group, you can say, or in crowd or in public, that person feel low esteemed. They should lack that much of confidence which they can show if they are like ideally body weight and so many things. So this low self esteem, low confidence will lead to depression, will lead to solidarity, and this is particular a social stigma. Correct? So these are the things which a girl or which an individual has to face if she or that individual is obese or suffering from obesity. So we have to manage obesity. It basically involves a combination of lifestyle modification. Why lifestyle modification? Because we have gained that much weight due to our lifestyle only. Whether it be an environmental factor, social factor, our dietary habits, our eating pattern, and so many things. So, adopting a healthy diet and involving us in regular physical activity levels, also with some behavioral changes, then only we can manage the obesity so easily. In some cases, some individuals take medications, that is pharmacotherapy. We will study it later. What is pharmacotherapy? Weight loss surgery, that is completely a surgery procedure by which we get rid of extra accumulated fat from the human body. Surgeries may be recommended to those individuals only who have grade 3 obesity along with so many medical complications or health related complications. Other than that, we couldn't suggest the surgeries to all obese patients. No. If that person is having like health complication or he is or she is in stage of grade 3 obesity, then only doctors or dietitians suggest them to go for the surgery because surgery have their own complications. So why surgery? Before surgery, we have to prevent it by, and how we could be able to prevent the obesity by promoting healthy eating habits, regular physical activity, like 30 to 35 minutes of physical activity, moderate physical activity only, help us to get rid of obesity or prevent obesity and prevent overweight along with healthy eating habits also. Then creating supportive environments which facilitate healthy choices. It also can help an individual to prevent the onset of obesity from this root stage. Public health initiatives and policies are also like they are circulating and they aim at reducing the prevalence of obesity. How we can overcome this global health issue, because nowadays obesity is like globally it is spreading only. Every third individual is obese, every third individual is overweight, and it is showing negative effects, it negatively impacts the human health by what we could say, like cardiovascular health, diabetes mellitus, completely type 2 diabetes is completely a lifestyle disorder. So it is important to note that each individual situation is unique. Every individual, maybe some girl or some individual has her hormonal imbalances, that's why she is obese. Maybe some is living a very sedentary lifestyle, like we were living at the time of COVID, at the time of lockdown, that's why she is obese. Some may have their metabolical health issues, that's why she is obese. So we have to tailored our approaches to get rid of that obesity or to manage that obesity as per the individual's need, as per their requirements, as per their circumstances, as per their causes of obesity. So person to person, they seek guidance from healthcare professionals such as doctors, dietitians, psychologists. They provide their valuable support and guidance how to overcome the obesity. Before, like what we could say, like somebody has ideal body weight of 60 kilo kg. Let's suppose she has there is a woman, she has an ideal body weight of 60 kg only, but she has overweight or obese by 90 or 95 kg. Then we have to set a mark weight. First of all, we have to set a target weight that is not like what we could say, it's up to 85 only. Like from 90 to, first we have to come at the bar of 85 to 90, because we can't jump although like together from 92 to 60, that is very inconvenient and impossible also. Why? Because having a fat cells comprises fats, stored fat inside it, we could be able to burn the fat only by exercising, by uh, for modification of eating habit, but we couldn't be able to lose the fat cells. They will only shrink. So our target weight should be like in the considerable range of the present body weight. Then, whenever we achieve that target weight, suppose we have targeted the 85 kg, we have achieved that weight, then only we just reduce it to 8 to 10 kilograms. Then we will do physical activity, we will modify our dietary habits, we could tailor our diet charts accordingly to our new targeted body weight. So now we'll discuss the etiology of obesity in women only. First reason is that their genetic factors, how genetic, how hereditary influences obesity in women. First of all, it examines the role of specific genes which they inherited from their forefathers, from their parents, and their genetic variations and their chromosomal orders, and sometimes their genes will obesity susceptible. That's why they only living a sedentary lifestyle and having so much weight gain. So there are basically a prominent role of genetics or genes in obesity, which interplay between the environmental factors as well as, because environment create a strong impact on everything, on our chromosomes also. It affects the complexity of genetic contribution, and it will lead to ultimately higher body weight or accumulation of body fat. So when we compare obese and non-obese people for variations in genes, it could influence behavior such as drive to overeat or tendency to be a sedentary only, because this is the only possible reason, if whether we are having a very sedentary lifestyle or we are overeating. So it, both in both that and individuals, their genes could be of like their genes could vary. We can see so much variations in their genes or metabolism. Every individuals has their own capacity of metabolize so many different nutrients. Like somebody has a capacity of using dietary fat as energy source, but somewhat in some cases we could able to see that their dietary fat is absorbing and stored as fatty acids, stored in the form of fats in the adipose tissue. Their metabolism is slower down as compared to other individual to use it as a energy source. So many studies have done, and it identified that several genes that may contribute to obesity by increasing hunger and food intake, like hormone leptin and hormone ghrelin, hunger hormone and appetite suppressant hormone. So if there is a person who have a genes which promote ghrelin hormone more as compared to other person, so that individual who's having ghrelin hormone more, their appetite will stimulate more, he or she might be overeat, and it will ultimately lead to gain in weight or obesity.
Please repeat this,
Next,
ma'am.
ghrelin hormone, ghrelin.
Can you repeat this whole point?
Sorry,
Please repeat it. Not about the
like
hormones, whole like process about the ghrelin hormone.
ghrelin
Or-
hormone, basically it is produced by our stomach, and
Okay.
what we could say, it is also known as hunger hormone. It basically tells our brain that we are hungry. So if there is there are two girls, a girl having genes which produce more ghrelin hormone, and a second girl whose ghrelin hormones are like lower. Someone's mic is on, I guess. My camera is off also. Sorry, I haven't seen. Where we are? Huh. Like there are two girls. One is having ghrelin or genes which produce more ghrelin hormone, and second girl is having genes which produce adequate or optimum ghrelin hormone. So what we could be able to see, we could able to see like the girl who is having more ghrelin hormone production will feel more hunger. Her appetite is more, so she will overeat usually. Then that overeating or eating more carbs, especially simple carbs, ultimately lead to weight gain, and due to environmental factors and other gene susceptibility to obesity, it will lead to higher grade of obesity. Clear?
Yes, ma'am.
Okay, so now the second
मैम
factor,
एक
that is
क्वेश्चन था मैम, यहाँ जो फैट
yes.
सेल्स का आप बताए, we will they will the person who is obese, she will not be able to get rid of the fat cells, ये जो बताया मैम, फैट सेल्स क्या, जो जो obese आदमी है, जो भी obese person है, उसका फैट सेल्स हमेशा रहता है, वो कभी भी rid नहीं हो
हाँ,
सकते फैट सेल से
एक्चुअली
उनको।
होगा क्या, लाइक फैट सेल्स बन गए बॉडी में, ठीक है,
हाँ
अब उनमें फैट स्टोर हो रहा है, फैट एक्यूमुलेट हो रहा है। अब लाइक हम फिजिकल एक्टिविटी कर रहे हैं तो वो फैट बर्न हो रहा है,
हाँ,
बट वो
वो
सेल्स
सेल्स,
क्या होंगे, वो सेल्स श्रिंक कर जाएंगे।
ठीक है मैम,
तो
वो
वो
बट
सेल्स की,
वो वही
हाँ,
रहेंगे।
हाँ वो
shrink
रहेंगे,
करेंगे
वो सेल्स जब अल्टीमेटली अपनी नेचुरल डेथ उनकी जब होगी, दे विल गेट रिड ऑफ और डेड सेल्स इन द फॉर्म ऑफ, बस तभी उनका वेट लॉस होगा, बट वो सेल्स का वेट रहेगा। हम सिर्फ एक्टिविटी से क्या कर सकते हैं, जो उसके अंदर स्टोर्ड फैट है उसको कन्वर्ट कर सकते हैं।
Okay, ma'am. Thank you, ma'am.
वेलकम। So second is our hormonal factors, how hormones, basically hormones play important role in obesity in women. Most specifically, their sex hormones, their reproductive hormone, estrogen and progesterone. It gives direct also other metabolical factors, oxidative stress factors, and so many things.
Ma'am, can you please repeat? Yes, ma'am. The
Basically,
connection was weak at that time. Please repeat this paragraph.
from where
Uh, from starting estrogen and progesterone, we have heard only
okay.
them.
Okay. So, how on what factors estrogen and progesterone will create effect? It directly create effect on adipose tissue metabolism first, then energy balance of that woman, then weight regulation of that woman, and their hormonal imbalances.
Ma'am, energy balance as in the food calorie intake is what you are talking about here?
Yes, both. Both. Sometimes a girl is having a negative energy balance. Sometimes they have a positive energy balance. Sometimes they have a neutral energy, that is optimum energy balance.
Okay. So energy balance, hormones, and physical activity.
Yes, energy balance, adipose tissue metabolism as well.
Ma'am, in order to figure out if it's the like if it's estrogen, progesterone, or hormonal problems that's affecting like women to not lose weight, so do we need to get them tested via some blood test?
Yes, yes, because later we will study in the premenopausal women, the estrogen is producing from ovaries. So it is playing its role. But in postmenopausal, the estrogen is creating in the cells. That's why it will lead to obesity. So that we have to get their hormonal checkup to know,
Ma'am,
like, yes,
what are the blood tests?
hormonal, like you could say the hormonal blood profile. So, like if we are going for thyroid hormone for say, so we could TSS, T3, T4, and if we are looking for other estrogen and progesterone hormones, then in laboratories they simply say that we have to check up our estrogen levels and progesterone levels. They just take out the blood, and the test is done from the blood only.
Any other, ma'am, hormonal blood test?
I would I will see and share it with you.
Okay, ma'am.
It is
Even
basically a complete blood hormonal profile in which we could able to look all the hormone, and specifically if we go for then for the thyroid hormone, we could specifically go for thyroids, for ovarian hormones like estrogen, progesterone, oxytocin. Then
Mhm.
we'll go for it specifically.
Ma'am, like even in adolescence, like we'll go for these blood tests only.
Yes. First, we go for the thyroid only. From thyroid hormone, we could able to detect if there are other hormonal imbalances or not.
Okay.
Like in some case, some females, there is a uprising prolactin hormone, for example.
Mm-hmm.
So, because of prolactin, the girls could suffer from the milk ejection in their
Mm-hmm.
adolescent age only. And there are so many reasons. There's a minor reason of to uprising the prolactin hormone is having so much medications of DSRs.
DSR is what, ma'am?
DSR is a what we could say. It is a antacid medication. Usually, doctor prescribes us gas.
Okay.
When we are on antibiotics, they give us the
Mm-hmm.
DSRs and
Mm-hmm.
pan 40, pan D. So
Mm-hmm.
due to that medications also some females might be apprised affect their prolactins levels whether they are pregnant or not, but their from their breast their milk is ejecting out.
Any other cause for it, ma'am?
Sorry.
Apart from antacids, there's any other cause to it?
Yes, so many causes of uprising of prolactin hormone. It is not only just a one factor how the prolactin hormone like increases or producing more and more. There are so many underlying causes of hormonal imbalances.
Okay, thank you, ma'am.
Okay, so
Ma'am,
how the
can you explain adipose
estrogen?
tissue metabolism?
Sorry, Muskan.
Can you explain adipose tissue metabolism in detail, thoda? Like how? Like
Oh, that I am only reaching.
okay,
So,
okay.
how the progesterone and estrogen link to obesity, or then after that obesity, it will how lead to heart disorders, strokes, and arthritis. Why arthritis? Because we are on the obese stage. That like we have so much weight gain, so much accumulation of fat cells, which directly affect our bone health also. So, fat around our abdominal region is a higher risk factor for diseases than fat stored around our bottom, around hips and thighs. Why? Because and how this fat distribution is decided, this fat distribution amongst the women is decided by the estrogens and androgens produced by the ovaries. So estrogen is basically a reproductive hormone, a sex hormone which is produced by the ovaries after the signaling from the hypothalamus in premenopausal women. So it is basically responsible for the ovulation during the menstrual cycle. And in postmenopausal women, their ovaries do not produce that much sufficient amount of estrogen because at that stage there is no need of ovulation. Their reproductive organ, their reproductive system is now not that
मैम
much
वो
capable.
एस्ट्रोजन के बारे में प्लीज थोड़ा अच्छे से बताइए ना, एस्ट्रोजन के लिए, एस्ट्रोजन के
Estrogen
बारे
is
में मैम.
that I will teach you after this complete topic. Because if
Ma'am,
we go for the estrogen hormone only, then we left out this
ma'am,
topic.
actually,
Okay,
we
ma'am.
are not from the science background. Like, so sometimes we need repetition.
Okay, we could do first complete this topic, then we'll go for the doubt session. If something will left, just put down in the group. We will connect it at any time. Whoever doubts, then I'll clear all your doubts completely. No problem. At any time. On Saturdays, we can discuss it in morning as well. On group, I will write. Just put down in the group. Okay. But just
ठीक है मैम.
complete the topic
मैम बीच बीच में
first.
थोड़ा हिंदी में भी बोलिएगा.
Okay, okay, no
ठीक है.
problem. Actually, we
थैंक
have
यू.
some students from the south also.
ओके
That's
मैम.
why.
ओके, थैंक यू मैम.
Okay. So, how this estrogen hormone is responsible? Like in postmenopausal women, their ovaries are not that much capable of producing estrogen hormone. Then their estrogen is producing in their body fat that in lower amount. Their estrogen levels are there, although in the reduced amount, and as well as it's not produced from the ovaries, it is produced from their body fat. Like in premenopausal women, or a girl or a woman is having a menstrual cycle, their estrogen is producing from the ovaries. Why? To ovulate, to release the egg, to get pregnant. That is a healthy reproductive cycle. But in most postmenopausal women, their estrogen hormone is producing from the body fat. Now, the changes with age, like in adolescent, in adulthood, in pregnancy, in lactating women, these sex hormones, estrogen and progesterone, are completely associated with changes in body fat distribution. Like they are linked. The levels of estrogen and progesterone is directly linked with the body fat distribution. Suppose there is a woman of in between 25 to 35 or 32, or we could say the childbearing age. So her fat is stored in their lower body. That shape is pear body shape or pear shaped body, because she is in a childbearing age. Now she has basically what we could say, उसका जो age है वो अब pregnancy का age है, वो child bear कर सकती है, वो mother बन सकती है, तो उसका lower abdomen जो है वो strong होना चाहिए. दैट्स वाई ये ईस्ट्रोजन और प्रोजेस्टेरॉन क्या करेंगे, फैट डिस्ट्रीब्यूशन हमारा अराउंड द एब्डोमेन रीजन ये स्टोर करेंगे टू मेक दैट लोअर एब्डोमिनल रीजन स्ट्रॉन्ग. But in postmenopausal women, now their estrogens are not producing from the ovaries. Why? Because they are not able to get pregnant or conceive. So उनका जो फैट होगा, जो उनका एक्सेस फैट होगा, वो स्टोर होगा अराउंड their central abdomen. That is apple shaped obesity, central obesity, which we could say. Clear the difference of fat distribution in childbearing age, that is in premenopausal and postmenopausal. How a woman is having a pear shaped obesity and apple shaped obesity. In some cases, in some females, after their postmenopause, after their menopause, they are on supplements of estrogen hormones. Then their fat doesn't accumulated around their abdomen. Their fat is usually pear-shaped body. Clear till here? Any doubt? Okay. So there were so many studies, basically it is done on animals, which shown that lack of estrogen hormone leads to excessive weight gain. Because at that time, body is unable to distribute the stored fat or excess fat. Now, second is obesity is linked with insulin hormone. You could also write it that insulin is a lipogenic hormone, which means the lipogenic is a term made up of two words, lipo plus genic or genesis, which means it helps the body to synthesize lipids.
Fat.
Yes. Somebody saying something? I was studying insulin is a lipogenic hormone. And lipogenic is a word comprises of two words, lipo, that is lipid, and genic means genesis. So insulin hormone helps to synthesize or formation of lipids also. It helps in regulating the glucose levels from the blood, but it also helps in fat metabolism. Like if excess of glucose is present in the blood of human body, it will directly convert to the fat only. Clear? So like this, insulin is linked with obesity. Insulin is producing by the pancreas, the beta cell of pancreas. In pancreas, we have alpha cells, beta cells, and gamma cells. From the beta cells, our pancreas producing insulin hormone, which is first of all important for the regulation of glucose uptake, regulation of carbohydrate. Like if there is blood sugar, sorry, if in our blood there is a levels or high rise levels or presence of glucose, glucose is there, our pancreas simply releases the insulin hormone, which insulin hormone act like a gate for every cell, every tissue. It just open the gate and that glucose is uptaken by the cells or tissues. If we lack in insulin levels, our glucose are not uptaken by the cells, and that condition is simply known as diabetes or hyperglycemia. ठीक, इंसुलिन हमारा एक गेट की तरह काम करता है सेल्स में. वो जस्ट ओपन कर देगा गेट को, जैसे ही उसको प्रेजेंस मिलेगी ग्लूकोज की, वो ग्लूकोज हमारी सेल्स में चली जाएगी, दैट गेट विल अगेन शट डाउन. बट इफ इंसुलिन के लेवल्स प्रॉपर नहीं है, हमारे पैनक्रियाज इंसुलिन लेवल्स अच्छे नहीं बना पा रहा है, या हमारी बॉडी इंसुलिन ससेप्टेबल है या इंसुलिन सेंसिटिव है, तो वो ब्लड ग्लूकोज ब्लड में ही रह जाएगी रिमेन, बिकॉज वो गेट ही नहीं ओपन हो रहे हैं, गेट को सिग्नल ही नहीं मिल रहा है, गेट को सेंसेस ही नहीं मिल रहे हैं कि गेट ओपन होगा तब ग्लूकोज अंदर आएगी. राइट, तो उस कंडीशन में हाइपरग्लाइसेमिया हो जाती है. Hyperglycemia is again comprises of three words. Hyper means high, glycy word is for glucose, and mia, MIA, is for something related to blood. So blood में glucose के levels high हो जाना is hyperglycemia, and hypoglycemia, hypo means low, blood में glucose के levels low हो जाना. आप लोग मीन्स कि यहाँ पे ब्लड के से रिलेटेड बात हो रही है. एनीमिया भी हम पढ़ते हैं, हाइपरग्लाइसेमिया, हाइपोग्लाइसेमिया, एल्ब्यूमिनिया, प्रोटीनीमिया, सो मेनी थिंग्स. ठीक है, तो ये MIA वर्ड जहाँ पे भी होगा तो वो अब क्लियर हो जाएगा कि ब्लड से रिलेटेड कुछ यहाँ पे कंडीशन है. सो इंसुलिन हमारा ऐसे काम करता है. इसके साथ साथ इंसुलिन ऑल्सो stimulates the fat metabolism, and it is an important procedure to make sure that energy is available for everyday functioning, for basal metabolic rate, and made so it is necessary to maintain our normal levels of blood glucose. If we are having more and more glucose, our pancreas will produce more and more insulin, and insulin is a lipogenic hormone, so it will also like help or in regulating the formation of lipids from the excess glycogen. So in a person who is obese, insulin signals are sometimes lost. Why? Because they have more number of fat cells. There are more number of cells and tissues. So their glucose levels will under like irregular or under control. So it will lead to type 2 diabetes and other metabolic syndromes like PCOS and other disorders. This slide is clear?
Yes, ma'am.
Okay.
Ma'am,
Next,
which
yes.
hormones will produce insulin, ma'am? Like alpha
Not
or
hormone.
something?
Insulin is a hormone itself. It is produced by the beta cells of pancreas.
Okay, ma'am.
Pancreas is organ. It has three cells: alpha cells, beta cells, and gamma cells. Alpha cells will produce glucagon hormone, beta cells will produce insulin hormone, and gamma cells will produce somatostatin, something like, I'm not sure right now. I'll just uh, let you know. But what glucagon and what insulin, they are completely antagonistic. You should note, I think this is an important point. Alpha cell will produce glucagon and beta cells will produce insulin hormone. They are completely act as antagonistic. Insulin levels will lower the levels of glucose from the blood, and what glucagon will do, वो एकदम हमारा इंसुलिन का ऑपोजिट काम करेगा. इट हेल्प्स टू ब्लड गेट मोर और मोर ग्लूकोज in the plasma levels. So they are completely antagonistic, glucagon and insulin hormone. Both are producing by the pancreas.
Thank
So
you, ma'am.
third cause, Okay. So third cause or third factor is our socio-cultural and environmental factors which causes or which leads to obesity. So like emotional and physical health and stress, societal norms, some certain cultural practices like in some region their cultures is basically eating more and more of saturated fats, and someone have a tradition to eat like more sweets and so many things. Sometimes like what we could say, eating habit to not waste food. Leftover food should be eaten to avoid wastage. It will lead to obesity. Some women's they eat their child's leftover. They will wait a minute. Okay, so a habit of eating a leftover of child or any family member, it is basically a simply we can say it is a overeating only. We are eating that food to avoid wastage, but we are not required to eat that. Our body is not that like it's not adequate nutrition for our body only, that to eat from others plate to avoid wastage or indulging in extra sweets in the festival region. So at the time of festivals, we are also like overeating the sweets, and like in the festivals like Raksha Bandhan and Bhai Dooj, we have so many sweets in our fridge and refrigerator only. So it will actually indulging in extra eatings of sweets on festivals. Sometimes stress eating also. Some girls, some women suffer from stress eating and their irregular meal time also. It will lead to obesity. So now next is health implications and comorbidities. How obesity is linked. So first is our metabolic consequences of obesity. It directly increases the risk of insulin resistance first, like insulin sensitive. If we could go for checkup at this time only, half of ourselves are insulin sensitive. Why? Because of eating habits, because of our lifestyle, because of our physical activity level, we are insulin sensitive. That's why in India, the cases of diabetes are uprising. So obesity is also it directly linked with the metabolic complications. It directly linked with the chemical reactions going inside the body. How the insulin will affect a person is having more or no number of cells. A girl or a woman is having so many number of cells which she is not required. Now her pancreas will only able to produce that much insulin according to her ideal body weight, not for that gained body weight. So its insulin levels will affect it. Her uptake of glucose from blood will affect it, and this will lead to diabetes. First, metabolic consequences. Then, due to extra weight, or we could say fat accumulation, it is also linked with hyperlipidemia or dyslipidemia, that is irregular or unbalanced lipid profile. We have reduced HDL levels, high density lipoprotein, which is known as good cholesterol, and higher level of LDL, low density lipoprotein, which is known as bad cholesterol. You all are aware of functioning of HDL and LDL? Okay. So this dyslipidemia is linked with that. And then imbalanced thyroid function, like hyperthyroidism, hypothyroidism, both of them linked with our BMR, higher BMR and over BMR. That's why we were gaining weight and we were just losing weight. Then PCOS, polycystic ovarian syndrome, and type 2 diabetes, that is because of insulin only. So there are so many underlying mechanisms which link to obesity, to metabolic abnormalities, which include adipose tissue dysfunction and chronic inflammation, that is aches and pain in the body in specific regions also. Please take me in. Now, how obesity will give its negative impact on bone health. So, obesity in women, it will causes low bone density. It will affect the demineralization. It will like mineralization of. It affects the mineralization of bones. That is uptake of calcium, uptake of magnesium, uptake of phosphorus levels. So it basically demineralizes the bone, which will lead to low bone density. That's why they are more prone to fractures and like softening of bones, like softening of bones, that is osteomalacia. And if they are prone to fractures, hip fractures usually, generally they are more, and their rate is increasing in adult people's. Condition like osteoporosis and osteoarthritis and gout is also due to the purine metabolism first itself, but in obese patients or in obese people, it will like, क्लास है भैया जी, अभी दे दूंगी, क्लास कर लो। क्या पढ़ा रही थी मैं?
About gout, why it happens in
About
obese
gout and
people.
purine metabolism. Thank you, Muskan. Thank you. So gout is basically of uric acid, that is directly simply a purine metabolism. If we are having a irregular purine metabolism, we are taking a high purine diet or a purine rich diet, then our uric acid levels will be shoot up, it will uprise and then accumulated, and ultimately we will be suffer from gout. But in obese people also, it gets severe due to extra fat cells, extra number of cells. So it gets severe in obese people, and ultimately it affects the bone health of that individual, that women.
Excuse me,
Clear?
ma'am. मैम,
Yes.
यूरिक एसिड, हाई यूरिक एसिड के क्या कॉजेज हो सकते हैं?
उसका सिंपल कॉज होता है कि हम बहुत ज्यादा प्यूरिन रिच डाइट ले रहे हैं,
लाइक प्यूरिन रिच डाइट मतलब कैसी डाइट मैम?
लाइक हम ऑर्गेन डाइट बहुत ज्यादा ले रहे हैं, हम प्यूरिन रिच फूड में हम ये मीट्स वगैरह हम बहुत ले रहे हैं, बेसिकली ऑर्गेन मीट्स आर वेरी मच
मैम, इफ
रिस्पॉन्सिबल।
समवन इज वेजिटेरियन और
Not my
उनका
voice is
प्यूरिन
not
बढ़ा
clear.
हुआ है,
एक एक करके आप लोगों का वॉइस बहुत एको हो रहा है।
मैम अगर कोई
अब
वेजिटेरियन है और फिर भी उनका यूरिक एसिड बढ़ा हुआ है, तो उसका क्या रीजन हो सकता है और उसका क्या
then
क्योर हो
due
सकता है?
to high intake of other proteins, because ultimately जो हमारा अमोनिया है वो जब उसका हम डाइजेशन करते हैं, हमारी बॉडी डाइजेशन करती है, तो अगर वो यूरिक एसिड में कन्वर्ट हो रही है, क्योंकि अमोनिया इज हैजार्डियस फॉर ह्यूमन बॉडी, तो हमारी ह्यूमन बॉडी क्या करती है, उसको फटाफट से कन्वर्ट कर देगी यूरिक एसिड यूरिया में, जिससे वो इजीली पास आउट हो जाए थ्रू किडनीज। सो अगर हमारी बॉडी में एक्स्ट्रा प्रोटीन, एक्स्ट्रा अमोनिया भी प्रोड्यूस हो रही है, तो भी वो कन्वर्ट तो होगी यूरिक एसिड में ही, बिकॉज उसे एलिमिनेट होना है बॉडी से। और अगर अमोनिया अपने ही फॉर्म में रहेगी तो इट विल टॉक्सिक, इट विल बी हाईली टॉक्सिक। दैट्स व्हाई ह्यूमन बॉडी उसको फटाक से कन्वर्ट करती है यूरिक
मैम
एसिड्स
ये
में, जिससे
ऐसा
कि
स्टोन के केसेस में भी हो सकता है कि अगर किसी को
हाँ
स्टोन हो,
जी, लाइक
किडनी
स्टोन भी
स्टोन हो।
प्रोटीन की वजह से हो जाते हैं। अगर
ओके।
हम बहुत ज्यादा, लाइक कोई विमेन है, कोई अब बहुत ज्यादा वेट गेन का अगर किसी को एकदम से वो हुआ, तो वो बहुत हाईली रिच प्रोटीन डाइट ले रही है, तब भी वो प्रोटीन, जब एक्सेस प्रोटीन है, तो इट विल बी क्रिएटेड रीनल कैल्कुलाई ऑल्सो। वाई? क्योंकि उसको फिल्टर आउट करना, देन किडनी रीएब्जॉर्प्शन करती है, तो वो एक्सेस जो है फिर वो एक्यूमुलेट होने लग जाता है। तो स्टोन्स भी, रीनल कैल्कुलाई, रीनल कैल्कुलस भी एक्स्ट्रा प्रोटीन की वजह से हो जाते हैं।
ओके मैम।
सो आलमंड्स खाओ, हेल्दी ग्रीन्स लो। अगर लाइक किसी को गाउट है तो बेसिकली उन्हें अपने प्यूरिन इनटेक पे ध्यान देना पड़ता है। आप ऑर्गन मीट्स, आप ट्यूना फिश,
मैम
ये सारी चीजें। हाँ
जस्ट मैम, लाइक आपने बोला एक्स्ट्रा प्रोटीन है तो स्टोन्स होते हैं रीनल,
यस,
ठीक है। तो मैम तो रिपोर्ट्स में अगर नहीं आता, हाउ वी कम टू नो दैट वी आर जस्ट गोइंग फॉर एक्स्ट्रा प्रोटीन्स इन पेशेंट,
लाइक इफ जरूरी नहीं है एक्स्ट्रा प्रोटीन से ही रीनल कैल्कुलाई हो, इट इज ऑल्सो वन ऑफ द अंडरलाइंग कॉजेज आई एम सेइंग। लाइक किसी को कैल्शियम स्टोन्स हैं, तो उनका फिर कैल्शियम लेवल्स हमें बस रेगुलेट करना होता है। किसी को ऑक्सलेट स्टोन्स हैं, तो फिर हमें सीड्स वाली चीजें उनकी रेगुलेट करनी होती हैं। वाई? क्योंकि उनको फिर सीड्स जाएंगे बॉडी में, वो ऑक्सलेट में जैसे ही उनमें ऑक्सलेट आयंस इतने ज्यादा होंगे, तो वो एक्यूमुलेट करेंगे, किडनी उन्हें फिल्टर आउट नहीं कर पाएगी।
then ma'am, what is the test for just to how will come to know what is the test for
Okay, okay. So
diagnosis of
you are
stone?
asking test. So it is basically first we can detect it from urine, like proteinuria, albuminuria. हम अपने यूरिन में एल्ब्यूमिन के लेवल्स चेक कर लेते हैं। हमारे यूरिन में प्रोटीन के लेवल्स, प्रोटीन्यूरिया कंडीशन अगर है, तो इट मींस वी आर हैविंग अ हायर प्रोटीन। एंड क्रिएटिनिन रेशियो, ब्लड यूरिया नाइट्रोजन के लेवल्स, इसका पूरा रेशियो आता है अगर आप अपना KFT कराओ। तो इन सारी चीजों में हमें ये हम डायग्नोस कर सकते हैं कि वी आर हैविंग अ डाइट रिच इन प्रोटीन। आप सबने ब्लड रिपोर्ट रीडिंग का वर्कशॉप कराया है एनरोल, अभी तक किसी ने किया है? ये अभी अपकमिंग अक्टूबर में ही हो रहा है, लाइक
No, ma'am.
ऑन वसुधा जी, हैव यू रिकॉल द डेट्स, कब है ये?
14th को है मैम।
14th of October में।
14, हाँ 14th इट इज अ ब्लड
मैम
रिपोर्ट
ऑनलाइन,
रीडिंग।
मैम
यस यस,
ऑनलाइन
इट
है
इज,
ये?
यस इट्स ऑनलाइन, बट इट इज वेरी गुड। इसमें आपको सारे जितने हम ब्लड प्रूफ मतलब टेस्ट कराते हैं, जितने भी पैथोलॉजिकल रिपोर्ट्स होते हैं, उनका कैसे डायग्नोसिस करते हैं, लेवल बढ़ गया है तो क्या होगा रीजन, व्हाई दीज लेवल्स आर हाई, अगर लेवल्स लो हैं तो देन व्हाई दीज लेवल्स आर लो, एंड व्हाट विल बी द रीजन बिहाइंड दिस। ये पूरी पैथोलॉजिकल रिपोर्ट रीडिंग होगी,
Ma'am, I
उसकी
also want to
PPT।
enroll in this.
हाँ, so you
Okay.
just connect to your respective institute, all of you,
Okay,
and just go for it, because I think it's costing 1200 plus GST, so it will be
okay,
only
ma'am.
1400 only.
Okay, ma'am.
It is online, you will get the PPT, and it is very good because we can only suggest diet to individuals when we get able to know that they are these underlying problems, when we are able to read the reports में लाइक ये तो हमें पढ़ने में आ जाता है कि लेवल्स बढ़ गए हैं, लेवल्स कम हो गए हैं, बट अब उससे होगा क्या, व्हाट विल बी द आउटकम, वो भी पता होना चाहिए। लाइक MCV के वैल्यू, कॉर्पसल्स वॉल्यूम, MCH के वैल्यूज बढ़ जाते हैं, घट जाते हैं, तो ये तो पता है कि इन्फेक्शन हो गया है बॉडी में, बट किस चीज की कमी हुई है, एमसीवी में हमारा फोलिक एसिड की कमी हुई है, बट एमसीएच में हमारा साइनोकोबालामिन बी12 की कमी हुई है। तो ये चीजें हमें पता होंगी, देन ओनली हम उन्हें सजेस्ट कर पाएंगे। लाइक हमें पता है फोलिक एसिड की कमी से एनीमिया है, तो हम उन्हें फोलिक एसिड रिच डाइट देंगे। व्हेन वी गेट टू नो कि उन्हें साइनोकोबालामिन, दे आर साइनोकोबालामिन डेफिशिएंट, देन वील गो फॉर B12 ओनली। Then why will we go for folic acid, na? So talk to your respective institute and must enroll yourself in this workshop because it is
Thank you.
very important.
Yes, ma'am. Thank
Okay,
you.
I'll send the detail on the group also.
Okay.
And this gout happens to heavy, like obese people, because fat cells ज़्यादा हो तो production of uric acid is not appropriate to that, right?
Yes, their excretion is not appropriate and their hormonal levels are not appropriate. So many causes. So they are
All
more
these
prone to
underlying
having gout.
causes, basically.
Yes, yes. So they are more prone to having gout also. The obese people are more prone to having osteoarthritis, osteomalacia. Clear? So next are cardiovascular health risk, like heart as well as the vessels also. Like we were having atherosclerosis, arteriosclerosis, dyslipidemia, and abnormal lipid profile, hyperlipidemia. So the obesity is directly linked to our cardiovascular health also. How? Because it increases the risk of hypertension first, then it will lead to coronary artery disease. Coronary artery disease means the arteries, those are interlinked with heart. Then it will also increases the risk of having stroke. Why? Because due to obesity, again number of more fat cells, they are directly linked to lower level of HDL and higher level of LDL, and this is the major reason to having stroke and higher cholesterol levels in the blood of human body. And then only it will lead to heart failure. High cholesterol levels, deranged lipid profile, endothelial functions, inflammation, and oxidative stress. What is oxidative stress? Basically, they are ROS, reactive oxygen species. ROS. This is oxidative stress when they are like, if there are incomplete oxidation, or our body is producing more free radicals, more and more free radicals, so it will create a oxidative stress on human body. So now in that case, we also need antioxidant to get rid of that free radicals which are damaging our healthy cells, our healthy tissues. So these are antioxidant like vitamin C, vitamin E will act as a great antioxidant, and they will get able to rid of that reactive oxygen species, and the oxidative stress will get reduced. So these things are also seen in obese women. Heart attacks in women become more
Ma'am,
of a
what's
concern.
ROS?
Yes,
What's the full form for ROS?
it's reactive oxygen species. Basically, they are free radicals. They are reacting highly. They are damaging our healthy cells. So they are not good. And to get rid of them, we have to enrich our diet in antioxidant. Anti means something which will go against it. So antioxidant. These products will get rid of the free radicals. That's why they only known as antioxidant. Terminologies clear कर लो, terms clear कर लो, आधी साइंस अपने आप क्लियर हो जाती है. लाइक अब आप लोग कहीं पे भी वर्ड MIA देखोगे तो विच मीन्स ब्लड से रिलेटेड बात हो रही है. जेनेसिस है तो इट मीन्स सिंथेसिस हो रहा है. लाइसिस लिखा है विच मीन्स कि यहाँ पे ब्रेक डाउन हो रहा है. क्लियर?
मैम लाइक अगर किसी का बीपी हाई हो तो उसको लाइक क्या रेमेडी होती है लाइक उस टाइम कम करने के लिए विद मेडिकेशन अगर वो
उस टाइम हम उन्हें हिबिस्कस डिकॉक्शन दे सकते हैं। हिबिस्कस हो गया, मेथी सीड। हिबिस्कस वाटर इज वेरी गुड फॉर
Ma'am, how to prepare
hypertension.
that? Just tell also, no, sir, we are writing.
Sorry.
How to prepare hibiscus concoction? Just
Just
boil the
simply
hibiscus.
boil a complete flower in a glass of water, strain it and drink it. It is very good for hypertension.
We have to boil that.
Yes, yes. You have to like make it a tea, make it a decoction.
Okay,
You
ma'am.
even get those
Hibiscus.
tea sachets these days, the
Yes,
pre-packed ones.
yes, yes. In
For
market, it
instance,
is coming from like organic, from the name of organic. But if we are having a natural hibiscus flower, then why go for the sachets? Just boil it in water. It is a very simple procedure.
यार कीड़े रहते हैं
Strain
उसमें.
it, boil it, strain it, and drink it. It is very good for hypertension.
Ma'am, if it's
Like,
like
yes.
hypertension, then only we can give hibiscus water, or if the BP is normal but the lipid profile is not
we will say it patar chat.
Yeah. And ma'am, you said
And
cranberry juice. तो वो मतलब पैक्ड वाला टेट्रा वाला also helps या fresh
no,
cranberry?
actually tetra and pack juices are not that much good. They are only good in the ads and advertisement only. So let's just finish this topic first. Heart attacks in women become more a concern after menopause because their estrogen level starts to drop and they are not producing from ovary, they are producing in the fat cells. Clear? Third is that females reproductive health. So how obesity is linked? Obesity will create hormonal imbalances. It will create insulin resistance in obese women. Now it will lead, both of them will lead to irregular menstrual cycle. First, reproductive health consequences. Then, if it is not controlled, they are at higher risk of developing PCOS. Now there we could able to see so many cysts in their ovaries, that is polycystic ovarian syndrome. So obesity is also linked with infertility. Why? Because obesity is not obesity is linked with reduced production of reproductive hormone. So if our reproductive hormones are not up to the mark, that female will suffer from infertility. And if she will conceive anyhow, she will face so many complications in her pregnancy. She will suffer from gestational diabetes. Then long term effect on the neonatal born or like preterm delivery also. How gestational diabetes is linked with the pregnancy, matlab how diabetes is linked with pregnancy, you are all aware of the fact behind it?
No, ma'am.
Okay, so what we could see at the time of pregnancy, the placenta will suppresses the absorption, the insulin action. It will simply suppress the insulin activity. That's why there is a occurrence of gestational diabetes in some females. As soon as the pregnancy will completed, the placenta will remove and they will again come to their normal insulin functioning. So placenta is the responsible factor behind the gestational diabetes. Okay. So there are underlying mechanisms including hormonal imbalances, insulin resistance, and inflammation, and so many things which are directly linked with obesity and reproductive health. Next is cancer risk. Obese women are prone to breast cancers, endometrial cancers, ovarian cancer. How ovarian cancer? If they are at risk of PCOS, then it will, if not treated, if untreated, it will ultimately lead to ovarian cancer and colorectal cancer. Uh, they are major risk factors due to hormonal imbalances in obese women. Okay. So their hormonal influences, chronic influences, and again insulin resistance. These are the reasons. So now how we prevent and manage the obesity. So we get discussed the fact of obesity. First was lifestyle behaviors, eating patterns. So first we have to manage our lifestyle, our eating habits, and to manage or to prevent the obesity. So first is lifestyle interventions. So there are so many evidence which are based completely based on lifestyle disorders or lifestyles. to prevent the obesity in women and to manage the obesity in women. So in lifestyle, we first discuss dietary, tailored diet, then physical activity. Because of low physical activity or leading simply a sedentary or more low reduced sedentary lifestyle, it will ultimately lead to obesity. Behavioral changes like stress, emotions, and psychosocial support, these things will play important role in achieving the optimum weight, ideal body weight, and maintain that weight also. Okay, it is not that only कि हमने weight reduce कर लिया, we have achieved that weight, targeted weight, but we have to manage that weight for longer time, for like for longer duration, then only we get able to reduce this obesity. If we achieve targeted body weight, we'll just go again on our bad lifestyle, we will again get obese only. So reduce करना is easy, but उसे maintain भी करना है, then only that weight loss will be successful. Okay, so how so just let come to the points of how lifestyle interventions can be done. Adhering to strict alkaline diets, that is full of fruits, vegetables, and whole foods. Why whole foods? Because they whole grain cereals having insoluble fiber. That's why whole foods are important. Now, what we have to eliminate from our diet? Foods like white sugar, sugar flour, processed food, canned juice. One of you asked Tetra Pak juices, na? Tetra Pak juices are, or canned juices, processed juices are the responsible cause. Sodas, bakery products, especially. Why? Because they have so much flour and flour only, so much sugar, and it will lead to obesity, it will lead to overweight, and it will then again lead to chronic diseases. So, bakery products like breads, cookies, cakes, if we are restricting ourselves from these things, we will ultimately able to lose our weight. Why? Because they are directly linked to weight gain, and we can save ourselves from the complications of obesity. So it is also advised to people that after tailoring your diet, after modifying your diet, just exercise for at least 45 to 50 minutes in a day in a combination of cardio and strength training. Okay, it will help in building muscles, muscle mass, and but better functioning of cardiac muscles. Like strength training will lead to muscle mass, and the cardio exercises will lead to betterment of cardiac muscles. So thereby it will increase metabolism, it will increase a healthy heart. Exercises like swimming, yoga, jogging, pilates, boxing, walking, high intensity workouts, playing sports like table tennis, cricket, squash, basketball, football, like in which we are involving our heart. These exercises are very beneficial. So for water intake, we could drink 4 liters of water as per daily basis. It will help to hydrate our body, and this hydration will directly link with the releases of hormones that are responsible for growth and hormone, and as well as complete metabolism going inside the human body. Clear? Lifestyle interventions are clear. Should we move to the next? That is pharmacotherapy. Pharmacotherapy is again comprises of word pharma and therapy. Like we are get managing the particular condition from the medications. And for obesity, which medications are known, they are basically anti-obesity or anti-obesity medications. They all are pharmacological agents. They are having those chemicals, they are having those chemical composition which ultimately reduces the weight or help our body to get lower absorption of fat from our diet, or just eliminate the excess fat from our diet and other things. So, what is the principle behind these medication and drugs? They alter the fundamental processes of the human body, weight regulation, by either reducing the appetite. Like if we are on a medication which suppresses our ghrelin production, hunger hormone production. So, what we could feel, our diet, our appetite will reduce. So, our if our appetite will reduce, again we will not overeat, and it will ultimately help us to get rid of extra weight, get rid of excess weight. And some medications are there which directly reduces the absorption of calories, and there are some medications also which directly reduces the absorption of fat, absorption of dietary fat. They do not emulsify the fat, hence the fat will not digested. And if the fat get not digested, it will not get absorbed by the intestines. And that fat simply eliminate in our stools. That condition is known as steatorrhea, in which our stools are having presence of lipids or fats. Steatorrhea.
And what is the
So there
spelling?
are
Spelling.
STA Steatoria, Teorheai.
Okay.
Ma'am, what was the second one?
What is
One is reduce appetite, one is reduce absorption of fat, and there was one more, right? Absorption of something.
first was just pardon what you were saying.
So that these medicines are of three types. One will reduce the appetite, so they will not feel hungry.
Mhm.
One will reduce the absorption of fat, and there was one more that you mentioned. I couldn't hear it.
Basically, I think these two only, reducing the
Yes,
absorption
ma'am.
of fat.
So it will not be emulsified. You were explaining that.
Okay. Can you?
आप लोग में से कोई कॉल कर रहा था मुझे? ओके.
What are the side effects of these medicines?
There are so many side effects, like steatorrhea is a first condition in which like we are having, just wait a minute, I think the slide has gone. Yes, it's there. Okay. Slide is visible. Okay,
Yes,
so
ma'am.
Yes, ma'am.
steatorrhea is for complication of having orlistat or having a anti-obesity drug. Like in that condition, our fat is not getting digested and it's simply eliminating through our stools. And second complication, if our fat is not get digested, then how our fat soluble vitamins will get work? They are only able to get completely absorbed or give their best if they get solubilized, and it will only solubilize in the presence of fat. But we are not having fat that get digested, we are not getting absorbed the fat, we just reduce the fat. Why? Because we are on pharmacotherapy. So these are the complications. Drugs known as orlistat, ibutramine, fluoxetine, etc. They are used as a pharmacotherapy or an anti-obesity drug. So a person should be carefully examined before prescribing these drugs. लाइक कोई है जो ऑरली स्टैट पे है, तो उसे फिर फैट सॉल्युबल विटामिन्स के सप्लीमेंट्स लेने ही पड़ेंगे, बिकॉज हम फैट नहीं डाइजेस्ट करा रहे हैं अपना। और फैट सॉल्युबल विटामिन्स वी हैव टू गेट दैट एडिक्वेट अमाउंट, क्योंकि उसकी वजह से ही हमारी बॉडी में अदर रिएक्शंस होंगी। बी कॉम्प्लेक्स विटामिन्स एंड vitamin C. I think A, D, E, and K actually. So those vitamins will not get absorbed. Vitamin A will ultimately lead to our nerve disorders, neurodegenerative disorders, eye disorders, and D will again, it will lead to bad bone health. And due to obesity, we are having a low bone density. So these will directly create a very severe condition. So we have to mark, if we are on pharmacotherapy drugs, if we are on anti-obesity drugs, we should carefully examine all our blood parameters. Then only we could administer these drugs. Third is surgical interventions that
Ma'am,
are
one
known
more
as, yes.
thing about pharmacotherapy. Who can prescribe these anti-obesity drugs and like
Basically, dietitians and doctors both prescribe these drugs. Both.
but we've not
First,
studied about it like
no. If you were in holistic, you will get studied in the chapter weight management in therapeutic module 6. And if you are a student of weight management, professional course in weight management and slimming therapies, then also you will get learned about these drugs. I think yes,
okay.
in module 6 only, in holistic and in DDHN.
Okay, ma'am.
You just come and meet me, I'll clear your all doubts. आप आ जाना
Okay, ma'am.
इंस्टीट्यूट, तो मैं
ठीक है मैम.
आपका एक बार रिवीजन इसका देख लूंगी, वेट मैनेजमेंट वाले चैप्टर का।
Okay, ma'am. Thank you, ma'am.
Okay. So next is our surgical interventions to manage obesity. That surgery is known as bariatric surgery, and those surgeons who perform this surgery, they are known as bariatric surgeons. Basically, we have we just reduce the amount of stomach, we just bypass the passage of stomach by surgery, so that we could not overeat, or we just eat below from the below our requirement. So in bypass, we what we'll do in bypass, the food is come directly go from stomach to intestine, so it will not get chance to digest completely, it will not get chance to completely absorb. So if our nutrients, if they are not getting digested completely, if they are not getting absorbed properly, they will eliminate simply, and we will not get lead to overweight or obesity. They are having so many common problems, like some of them are malnourished because our nutrients are not getting absorbed. In bypass, not only fat will affect, it completely affects all other nutrients also, right? So these surgeries are prescribed only in so much severe conditions, so much, like very higher risk of obesity, grade 3 obesity. Otherwise, these surgeries are not prescribed. Yes, 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 you may ask, because this is last slide only. You are muted. You are muted.
Sorry, ma'am. There are two things, bariatric and bypass, or it's only it's bypass is done in bariatric surgery.
Sorry, pardon.
मीन्स इस सर्जरी में ही बाईपास होता है बैरेटिक सर्जरी में, या इट्स अ डिफरेंट, दे आर
नो
डिफरेंट?
नो, सर्जरी में, बेरियाट्रिक सर्जरी में वी हैव लिपोसक्शन, हम लिपिड्स
या
को, फैट को पूरा सक आउट कर लेते हैं. वी
यस
हैव
यस
बाईपास सर्जरी, वी हैव दैट स्ट्रक्चर जो जिसमें हम पेट का एक
टाइम द
रीजन पूरा
स्टमक,
लेके
या
टाइट
स्मॉल.
बैंड. यस, बैंड सर्जरी. उसमें हम लाइक एक एब्डोमेन रीजन का पूरा स्टमक का पोर्शन लेते हैं, उसको पूरा बैंड से टाइटली पैक्ड कर देते हैं. वो
मतलब
स्टमक
मीन्स
हमारा हट गया. उसका रीजन ही,
छोटा
उसका
साइज.
प्रिंसिपल, हाँ, उसका प्रिंसिपल ही बेसिकली क्या है कि हम स्टमक का साइज छोटा कर देंगे तो हम कम खाएंगे. So if
तो
we are eating reduced amount, then we will get able to simply to reduce our weight. Why? Because our body is needing energy. Our body is having that much requirement of energy due to BMR. So then that fat, that stored fat will act as a fuel, act as a source of energy.
मैम वन मोर
Okay?
थिंग, जो आपने बताया बैरेटिक सर्जरी में लिपोसक्शन, दिस बैंड सब कुछ होता है, इट
हाँ
इंक्लूड्स
जी,
एवरीथिंग.
हाँ जी,
इसीलिए आई
हाँ जी,
वर्ड कि
ये
उनको फूड
सर्जरी.
शायद कभी डाइजेस्ट ही नहीं होता, एंड दे आर मोर प्रोन टू
Yes.
वॉमिटिंग्स.
यस,
फेट
ये
गोज टू
सारे
इंटेस्टाइन.
कॉम्प्लिकेशंस है, वॉमिटिंग,
ओके.
एस्पायरेशन. तभी ना हम सर्जरीज जो है वो बहुत सीवियर ओबेसिटी में ही प्रिस्क्राइब करते हैं. अदरवाइज हम उनको डाइट, टेलर डाइट एंड एक्सरसाइज एंड फिजिकल एक्टिविटी ही सजेस्ट करते हैं.
तो उसमें
बट
गॉल ब्लैडर
लाइक,
का वो खत्म हो जाता है, मतलब डायरेक्टली दे कनेक्ट टू
हाँ,
इंटेस्टाइन.
लाइक किसी पर्सन का गॉल ब्लैडर रिमूव्ड है तो फैट का डाइजेशन अपने आप ही इफेक्टेड हो जाएगा. लाइक गॉल ब्लैडर, व्हाट गॉल ब्लैडर डू, इट स्टोर्स द बाइल फॉर दैट टाइम. जब हम डाइट ले रहे हैं तो वो बाइल हमारा सिंपली फैट को इमल्सिफाई करता है. फैट के जो ग्लोब्यूल्स हैं, जो फैट का स्ट्रक्चर है, उसको छोटा करेगा. देन ओनली वो फैट इजीली डाइजेस्ट हो पाएगा. बट अब गॉल ब्लैडर तो है नहीं, तो उस टाइम पे लिवर से जितना बाइल आएगा उतना ही फैट हमारा इमल्सिफाई हो सकेगा. तो अब कोई पर्सन ओबीस है, बहुत ज्यादा सीवियरली ओबीस है, तो तब हम उन्हें प्रेस्क्राइब करते हैं, जिनमें हो सकता है गॉल ब्लैडर का सर्जिकली रिमूवल हुआ हो. बट हम नॉर्मल कंडीशंस में कभी भी पेरियाट्रिक सर्जरी नहीं प्रेस्क्राइब करते, बहुत ज्यादा क्रॉनिक कंडीशन, बहुत ज्यादा सीवियर ओबेसिटी में.
ओके.
Surgery is basically a last option. It could be a last option only.
ओके मैम, थैंक यू.
Welcome.
Ma'am, you said you'll give diet chart on adolescent.
Actually,
मैम
we are having 3 to 4 students. They are attending Deepti ma'am's workshop. That's why I haven't shared the right chart today. I'll share it tomorrow.
But
Okay,
ma'am, you
ma'am.
can share and discuss it later. Like those who want to just have an idea or just wanted to have a look, now you can share and you can discuss it in next class if you want. And ma'am, one more thing, in girls I have seen ke, matlab in their childhood they are very lean, very skinny girls. But
Yes.
after like this their period cycle when it starts, they start with the menstruation and they start gaining weight. What is the problem in those girls?
Because of their hormonal levels, basically at the adolescent, at the puberty age, their BMR is higher, right? And now at that time their hormone are only onsetting, their reproductive hormone are only producing, like estrogen, progesterone. Later stages our ovaries are completely capable of producing adequate hormones. So their fat distribution, body fat distribution is just linked with the hormone production only. And then also their peer pressure, their lifestyle, so many factors are responsible for that.
Okay, ma'am, thank you.
मैम कैन यू शेयर लाइक मेन हॉर्मोन्स जो फीमेल से रिलेटेड है उनका
Okay.
लिस्ट एंड वो किसकी वजह से इशू है, जैसे आज आपने बताया प्रोलैक्टिन डीएसआर की वजह से
हाँ,
हेवायर हो
like it
सकता है,
is
वैसे
one of the reason. It is one of the reason कि
हाँ
प्रोलैक्टिन
मतलब
हमारा गैस के टैबलेट से बहुत
हाँ
जल्दी इफेक्ट होता है और
बट
वो
एज
सब
पर
कुछ फीमेल्स में
हाँ
होगा।
बट नहीं ऐसे पॉसिबिलिटी है ना, तो इसका डेटा कहीं
हाँ
पे
जी।
लिखा नहीं हुआ है ना, तो इट इज बेटर कि आप लाइक एक अच्छे सोर्स से ही
Okay.
पता पड़े।
Okay. I'll just put it on my notes, complete hormonal
हाँ
table and then send it.
या मतलब वॉट एवर आप लेक्चर में आप हमको डिक्टेट कर दो या आप लिख के
Yeah, ma'am,
फोटोज
I've
भेज
noted it.
Okay.
It will be very helpful for all of us. Thank you.
Okay, sure. I'll just write a hormonal table and share it all with you.
Also, ma'am, all of these teas that you are talking about, इसके बारे में where can we read more?
हाँ
Because
जी,
DDH
एक सेकंड, एक सेकंड, हाँ जी। Wait a minute.
Guys, हमें किसी ने बुक्स बाय किए हैं इस कोर्स के लिए?
I
Yeah,
did
how many books are
One
there?
minute, 1 minute only.
one book.
One book.
It is this.
So much disturbances are today.
From a center only.
Yes. Okay, one of you is asking something?
Yeah.
Ma'am, I
Yeah,
was
you are
asking.
discussing in amongst
No,
you only.
no, we
And
were
she
talking
was
about
asking
notes.
about the
Not
study
Oh,
material for on this subject. How can we study deeply or uh, like for this topic? She was asking.
oh,
let's say
I
the
think
हाँ, दे
you
रहा।
all have blended learning. It has book, but if you want to buy a hard copy, you just contact your enrolled institute.
That
They will provide.
that I
Yes.
got, मैम वी आर आस्किंग कि जैसे आपने आज टीज बताई ना लाइक डिकॉक्शंस वगैरह, वो सब के बारे में मोर वेयर कैन वी रीड या रिसर्च अबाउट इट, क्योंकि गूगल पे कुछ भी आता है।
Okay. Just go for PubMed. PubMed and other research paper which are scientific, which are on
Ma'am, please
scientific websites.
repeat PubMed.
PubMed and research papers of NCBI, research basically medical research papers. From there, you get the authentic data of medical sciences.
Okay.
But ma'am,
Okay,
like for the basic knowledge,
what I can do, I'll share you research papers related to gynecology
yeah, ma'am,
in
that
the
will
group.
be better. Yeah, and ma'am,
Yes.
one more thing, like those topics which are not clear. कि मतलब अभी सब कुछ इतना क्लियर नहीं है फ्रॉम वेयर टू स्टडी लाइक वो भी बताइए ना कि मतलब वी कैन सी द वीडियो देयर आर सो मेनी वीडियोस
Okay. So let me know the topics, then I'll suggest.
मैम जो
Then I'll
आपने
able to
बताया आज
suggest.
तक अभी तक उसी का ही बता दीजिए हम
Okay. Like for
बेसिकली
gynecology, we'll go for book. What that book? I have a PDF of one book that is basically a nutrition in medical sciences. I'm not crosses, yes, it's crosses food science, I think. So I have that PDF. I'll share it in group. You just go through the book. That book is very good to basically tailor diet, like every disease, every chapter, every anatomy, every physiological health, everything is that in the book only.
एंड मैम इज देयर एनी बुक टू स्टडी अबाउट द मतलब ऑल बॉडी पार्ट्स एंड मतलब अबाउट फूड न्यूट्रिशन में
Anatomy
जो
and
हम पढ़ते हैं
physiology, you can go for CC Chatterjee.
सीसी चैटर्जी
Yes. And there is
व्हाट
one
बुक इज
writer,
दैट
Chaudhary, I think.
मतलब
Book
दैट
is of anatomy and
Ma'am, please
physiology.
mention all this in the group, ma'am.
Okay, sure. I'll share one PDF right now only. क्लास चल रही है भैया जी, बहुत जरूरी। Okay. Just give me 2 minutes. I'm sharing the book.
Guys, DDHN and holistic science सेम ही चीज है ना?
हाँ सेम है,
नाम चेंज
पहले
है
डीबीएचएन नाम था, अभी होलिस्टिक साइंस नाम हो गया,
I completed my
सेम कोर्स
DDHN
का।
back, so I'm like little confused when ma'am
हाँ,
says
I also confirmed with my teacher, she said it is the same.
Yeah.
तो आप लोगों ने कोर्स कर लिया है DDH?
नहीं, मेरा तो अभी 3/4 चल रहा है, लाइक
विच मॉड्यूल?
फोर्थ
उमा जी
मॉड्यूल।
आप फोर्थ?
फोर्थ मॉड्यूल मेरा
एंड
कंप्लीट हुआ है,
मुस्कान?
अभी थर्ड एंड फोर्थ का भी एग्जाम होएगा।
ओके, एंड मुस्कान जी आपका?
I am done with it.
ओके,
Completely.
एंड वेयर यू आर लोकेटेड?
Mumbai, Mulund.
ग्रेट
Okay.
अपॉर्चुनिटी।
आपका इंटर्नशिप भी हो गया?
कब
नहीं
से हो
नहीं,
गया?
वाह,
इंटर्नशिप
ग्रेट।
हो गया, मेरे क्लाइंट्स थे, क्लाइंट्स को रोका, हाँ अभी खुद पे फोकस किया, पढ़ाई किया और सब हो गया मेरा।
वाह,
बाद
ग्रेट।
में पढ़ रही होती।
तो इंटर्नशिप के लिए आपका इंटरव्यू हुआ तो वो टफ होता है क्या?
हाँ मतलब अगर नॉलेज मतलब बहुत एट पार है ना तो ठीक है, मतलब क्रैक कर लोगे। मैंने VLCC में 1 मंथ किया था एंड देन फिर मेरे को और अपॉर्चुनिटी चाहिए था तो मैंने किसी के अंडर ऑनलाइन भी करा था।
ओके, थैंक यू।
मतलब बेसिकली वो तो आपको देखना पड़ेगा कि आपको किस चीज में ज्यादा नॉलेज लेना है, क्योंकि VLCC में ज्यादा नॉलेज आपको मिलेगा मशीन्स वगैरह के बारे में या क्लाइंट कैसे हैंडल करते हैं। बहुत अच्छा मतलब एक्सपोजर है उधर तो।
ओके,
तो आप प्रैक्टिस करते हैं अभी प्रेजेंटली?
मैं कर रही थी, अभी मैंने थोड़ा सा मेरे पढ़ाई के लिए और हेल्थ के इश्यूज के लिए ब्रेक ले लिया। अभी फिर से करूंगी थोड़े महीनों में।
रुमा जी आप कहाँ से हैं?
मैं कोलकाता।
ओके,
सिंस मैं कॉमर्स बैकग्राउंड से हूँ तो कैसे था ना, मेरे को किधर और मैं मतलब बैकअप के लिए डिजिटल मार्केटिंग में आई डन माय पोस्ट ग्रेजुएशन, तो इसलिए मैंने बोला दो चीजों में मैं फोकस नहीं कर सकती, सो आई टुक माय
हाँ,
ब्रेक।
एक्चुअली।
मैंने PDF शेयर किया है ग्रुप पे, क्रॉसफेस
थैंक
फूड
यू,
न्यूट्रिशन केयर क्रॉसफेस। आप
थैंक यू
एक
सो
बार
मच
जस्ट
मैम।
गो थ्रू दैट। That book is like, I personally like that book. It
मैम
comprises of an
कितनी बड़ी
anatomical
शेयर किया आपने?
background, physiological background. Yes.
इट इज अ 3000 पेज का बुक, नो समथिंग अराउंड 1000 पेजेस का बुक।
Yes. Actually, this book is very costly, so I just somehow managed to get the PDF.
Yeah, even I had the PDF, but I never read it because it was so huge. I would forget things between.
But
मैम आपने कहाँ शेयर
also
किया है?
I have a purple handbook which is given by ICMR, which comprises the therapeutic modification in all the processes of human body system. That I'll also share. I have a PDF of ICMR comprising of healthy recipes. That also I'll share. Just remind me once. I'm
ओके
so
मैम।
what's the
मैम
I
वेयर यू
forgot,
हैव
but
शेयर?
I'll share that with you. Yes,
आपने कहाँ शेयर किया है अभी?
ग्रुप पे आप हो ग्रुप पे?
मैम आने को टाइम लग रही रहेगी, फाइल बड़ी है क्रॉस की।
मैम एक ये कोर्स करने के बाद एटलीस्ट विल बी एबल कि डाइट चार्ट दे पाए गायनेक इश्यूज वालों को, दे
Yes,
पाएंगे,
yes.
वो
आराम।
कॉन्फिडेंस आ जाएगा। ओके मैम। थैंक यू मैम।
मैम ये गायनेक के लिए कोई इंडियन ऑथर ने बुक नहीं लिखी है ना, मतलब ये गायनेक एंड न्यूट्रिशन रिलेटेड?
अभी तक तो मैंने भी नहीं पढ़ी है एक्चुअली ना। ये बुक जो हमारी VLCC की है, ये हमारी दीप्ति मैम ने लिखी है। She's
दीप्ति मैम की बुक्स आर वेरी गुड, दैट आई नो, आई हैव डन सो मेनी कोर्सेज दीप्ति मैम के।
मैम
somebody
सीटी
messaged
चैटर्जी जो आप
me
ऑथर बोले उनके बुक का नाम क्या है?
physiology और I think human physiology.
पार्डन
मैम
मैम?
वॉइस स्टॉप हो रहा है, पार्डन।
ह्यूमन फिजियोलॉजी। कनिका जी सेम
ओके
ग्रुप
मैम।
पे ही मैंने बुक शेयर किया है।
ओके मैम।
I'll try
Okay.
to find out the PDFs of books. So I'll share it in group. And those purple handbooks, yellow handbooks, which I was talking, I'll also share that in group.
मैम एंड ऑल्सो हॉर्मोन्स के डिटेल्स थोड़ा और डिकॉक्शन वाटर थोड़ा मैम जो हेल्प करते हैं। ठीक है मैम, थैंक यू सो मच मैम। मैम
तो
विल
मैं
लीव द
आप
मीटिंग।
लोगों को okay, like if you are having doubt, ask me, and if you don't, then you all may leave.
ओके मैम, थैंक यू मैम।
थैंक
मैम
यू मैम।
डाइट प्लान
विल जॉइन टुमारो।
हाँ, diet plan tomorrow pakka, because today we have not all students, na, that's why I haven't shared. Why they will, because the question is from one of those three members
Yes,
also.
ma'am.
So that's why I decided to share it tomorrow.
Tomorrow. Yes, ma'am. Thank you, ma'am. Goodbye, ma'am.
If they think today only, then only I share the right chat.
Yes,
But
ma'am.
they haven't joined, huh? They are attending ma'am's workshop.
Thank you, ma'am.
Thank you, ma'am. Bye, ma'am.
Thank you,
Welcome.
ma'am.
Bye bye.
Ma'am.
Ma'am, please share all the book names in the group also, ma'am.
Okay, name and PDF. I'm just sharing after the class. Okay.
Okay, ma'am. Thank you.
Welcome.
On the same group अभी तक तो नहीं आया मैम PDF.
But I have sent Tanika ji. आपको
Yeah,
उस
I'll
ग्रुप
wait.
में
नहीं मैंने
मुस्कान जी.
Oh, let's
Actually, it is Tanika ji. That's why you are not able to see. It's just sending. It's just sending.
okay, okay. और मैम अगर
Yes.
डाउट्स हैं तो when can I like
Yes.
clear those doubts or how to
Doubts of gynecology.
yeah regarding gynae.
We just this 30 minutes or last session is all of question and answer session. Ask this time
Okay,
only.
okay, ma'am.
Just write down all of your doubts, and in the last hours, we'll just clear all your doubts. We'll discuss it.
Okay, ma'am.
After the class also, if any one of you are having doubts, please mention those doubts in the group so others will also know about that.
Yes, it's very good. Like, just mention it. So, like, if somebody is hesitating to ask that question, she might be thinking, "Ma'am, it's very silly question or other things." So, ask everything. Ask a single detail also. I'll just clear everything. So, if any doubts,
Ma'am, for holistic science books, ma'am, other than
you can
VLCC text.
other than VLCC text, you will go for and Swaminathan's Food and Nutrition. It is of it comes volume 1 and volume 2. I'll share the link in the group. Just drop a message. It's a book name is Food and Nutrition by Dr. N. Swaminathan. And dietetics book, food science book.
मैम मुझे खाली वो मेडिसिन वाला अगर आप किसी को बता रहे हो उनका डाउट क्लियर करोगे तो कैन यू ऐड मी आल्सो इन दैट मीटिंग जिसमें आप वो फार्माकोथेरेपी एक्सप्लेन करोगे थोड़ा अच्छे से.
फार्माकोथेरेपी आई थिंक जो टुमारो का टॉपिक होगा ना कल का वो न्यूट्रिशन ऑन प्रेगनेंसी है. सो उसको कंप्लीट करने के बाद वी कैन डिस्कस अगर लाइक वी विल हैव टाइम.
So whenever
वैसे
you have
वी
time,
विल हैव टाइम. देन हम फार्माकोथेरेपी एक बार दोबारा से जिस भी दिन हम टॉपिक कवर हो गया था तो हम
नहीं
ऐसे
जैसे
भी
आपने
डिस्कस
बोला
कर
ना कि
सकते हैं.
हमने DDHN में एक 8th मॉड्यूल में पढ़ा था उसमें आपने
Okay,
वो
okay. That student is Lucknow's student
oh
only. So
okay
she is
okay
able to come to meet me like physically.
oh I thought she'll come online
That
only so I thought I'll ask you.
so when she comes
Yeah.
to get discussed, I'll just call you.
Yes, amazing. Thank you, ma'am.
Okay.
Thank you, ma'am. Bye, ma'am.
Or I can do one if completing this gynecology topic. If we will left out of time, then we will discuss the pharmacotherapy, all the liposuction and bypass surgery and gastric bypass, everything in detail.
Yeah. because मुझे वो bariatric surgery का फिर भी knowledge है, but the medicines I don't remember learning, or I might have forgotten क्या medicines देनी होती है, because usually
No,
Dipti
no,
ma'am or
medicines which I basically say want to either
मुझे voice
reducing
is
the
breaking.
medicines first reducing habit, okay, and other
मुझे voice
reducing the
is breaking.
absorption of calories. Now it's good. It's breaking now.
I'll text you. I can't hear what
Okay,
you're saying.
just
It's breaking a lot.
okay. Just text me personally, okay?
Thank you, ma'am.
I think my phone battery is getting low. That's why this volume problem is coming.
Yeah, even that PDF is sending, no, so the coverage gets lower.
Yes. Any other doubt?